Jason Sharp. I'm an interventional cardiologist here at the SAN, and I guess I've got a particular interest lately in structural heart disease as well. In other words, treating patients with valve problems and also holes in the heart and things like that through techniques, keyhole techniques, rather than with open heart surgery. Over the last few years, we've seen a big increase in keyhole techniques with procedures that previously needed open heart surgery, and the main advantage for the patients is that it's a much smaller scar, much quicker recovery, and they can be back home or back to work much more quickly. In addition to that, the risks of the procedure are often lower, just because you're not making as big an insult on the body when you do the procedure. It also has enabled us to treat some patients who may not have been able to be treated before, because in some people who have other medical problems and might be high risk for a large operation, we can do the keyhole technique safely and enable those patients to be treated who might have otherwise not been able to undergo therapy. TAVI is a technique. It stands for Transcatheter Aortic Valve Intervention, and it's a technique where we can replace the aortic valve in the heart through the groin instead of with an open heart operation. It's a relatively new technique. A lot of it's been developed overseas, and we're pleased to have recently been able to start offering the procedure here at the SAN. The technique itself involves putting a valve that is mounted inside a stent inside the patient through the groin, and then expanding that inside the aorta to replace the defective valve. So aortic stenosis is the treatment that TAVI is used for, and aortic stenosis is a relatively common valvular condition. It's more common in the elderly, and it can be due to degeneration of the valve over time. The aortic stenosis is bad when the valve starts to become severely restricted in its opening. Symptoms include breathlessness, blackouts, chest pain, heart failure, and really the last couple of years of life with this condition can be poor, with recurrent visits to hospital and patients being unable to do much and very restricted with their physical activity. So it's not a pleasant condition, and it certainly shortens life as well as reduces quality of life. So rather than needing to put this patient group through open heart surgery, opening up the chest and replacing the valve that way, we can now do this procedure through the groin in a technique that is much less invasive, and recovery time is faster. It was interesting starting a new procedure at the SAN and bringing this new technology to the hospital, and of course it involved a lot of training, not just for me but for the whole team. So firstly, I went overseas, mainly to Germany, where they've done a lot of this procedure and do it very well, and I was able to go to some of the leading centres in the world to learn about this technique. And then what we then did is we then took over several members of the team, including anaesthetists, intensive care specialists, nurses, and doctors, and we all learnt from our counterparts about what we needed to do to make this procedure a success. And then when we first started, the other team was kind enough to come up and help us, which was great. So it really was nice to see the whole team working together, get us all trained up, and then get the procedure up and running. It doesn't happen overnight, but it did all turn out very well, and so far we've been extremely happy with the results. So we've really seen some patients who were severely restricted. I can think of one lady of mine who came to see me. She was a very lovely lady who was full of life, but mentally, but very restricted physically by her condition. She could hardly walk from the waiting room in my office through to from my waiting room through to my office, and she really was finding that life wasn't worth living, and that she was unable to do what she wanted to do, in particular caring for her husband. And so we were able to replace her aortic valve with this TAVI technique, and she's done fantastically well. She's literally running up and down my consulting rooms now and looking amazing. So it is great to see some of these results and improve quality of life, not to mention quantity. I think starting a structural heart disease program here at the SAN, including TAVI, has been very important, and I think as a leading cardiac unit, we want to be able to provide the full range of services to the patients that we have and be able to offer them the best treatment that's available. And these days that does include TAVI. It also includes other structural heart interventions which we're performing here, such as Watchman device implantation, closing holes in the heart through the groin instead of with open heart surgery. And then in addition to that, other procedures that we perform with keyhole techniques are to treat coronary artery disease, such as inserting coronary stents, which have meant that a lot of bypass surgery is no longer required. Again, an open heart procedure being replaced by a less invasive technique, and with stenting it's often been performed through the wrist now instead of with an open heart operation. So really I think with that, as well as the new advances in electrical treatments of the heart rhythm service at the hospital's expanded greatly with the addition of 3D mapping technology for looking at heart rhythm treatments, as well as being able to freeze heart rhythm disturbances instead of heating up tissue inside the heart. So there's been a lot of advances in the department here at the SAN, where the interventional cardiologists, the structural heart doctors, the electrical specialists in the heart have all really increased the level of service that's being offered. And I think really now we're extremely well positioned as a leading unit in the area. Yeah, I think that it is important to know that a patient who is unwell with heart disease, if they come to the SAN, they are going to be offered the latest treatments regardless of what aspect of heart trouble it is. And I think now we're providing the cutting edge technology for all of these sorts of conditions here.